Hi everyone, this is Dr. Stefan. Welcome to Interstitial Lung Disease Info. In this episode, I'd like to discuss about an important topic, how to monitor pulmonary fibrosis over time. How do we follow up cases of pulmonary fibrosis? And do all cases require follow-up? For how long? What tests are we doing normally in clinic and what you can expect? For example, if you are under an interstitial lung diseases service and you are seeing doctors for these sort of issues. Now, some of the things in this video may be my opinion or my way of doing things as an ILD physician, but I think it covers much of what you may see in various clinics depending on where you are in the world. Obviously, always check with your doctor what tests you need to have, how often you need to see them, what's the situation in your case. It's really important because it depends. So I'm a person online and I'm trying to create a video that covers as much as possible. But at the same time, every case is different. You may have a special case in which things may not apply. So whether you need monitoring long-term for pulmonary fibrosis is a matter of a bit of debate because not all cases of pulmonary fibrosis actually require a follow-up. So there may be cases which are not progressive, or whether you require follow-up may be different depending on the type of pulmonary fibrosis that you have. There are many, many types of interstitial lung diseases that can lead to lung scarring. So whether that condition is more of an inflammatory condition or whether it's mostly a purely fibrotic condition such as idiopathic pulmonary fibrosis, the follow-up may be slightly different. It's really important to try to clarify what the diagnosis is. And you can check this with your doctor. Probably at the beginning, when you are first diagnosed, you will have a bunch of tests done. There will be maybe discussions between several specialists that you are seeing to try to come up with the best working diagnosis in your case, whether it's a working diagnosis of idiopathic pulmonary fibrosis or IPF or something else. It could be all there. And the follow-up scenario will depend also on the severity of your condition. It will depend on treatment options in your case as well. So whether you are, there are plans for you to go on maybe anti-inflammatory or immunosuppressant medication, that will require a slightly different follow-up. Whether anti-fibrotic or anti-scarring medication is considered as a first line, that again will require a slightly different follow-up and advice in your case. And then there may be situations in which no treatment is recommended in your case, either because of potentially you not tolerating some of the treatment options that are available, or maybe you're in a situation where best supportive care is the best option for you and symptom management may be prioritized. So in that case, maybe the follow-up will look a little bit different because it may not be driven by the pulmonologist, but maybe by other specialists, such as, for example, palliative care specialists. And not all cases of pulmonary fibrosis require follow-up. This is really important because not all cases are progressive. So when we say pulmonary fibrosis, we just mean lung scarring. And lung scarring can be caused by so many other things. I've tried to come up with some videos on my channel just to explain this in more detail because a lot of people, when they see pulmonary fibrosis, they assume the worst. They only find information about idiopathic pulmonary fibrosis online because that's the condition for which we have the most awareness. But then we can have lung scarring, for example, in patients who have had tuberculosis in the past. Doesn't necessarily mean that form of pulmonary fibrosis, of lung scarring, will progress. It may not get worse. You may just have a little bit of damage on the lungs that will remain the same. So that will require a different type of follow-up. But it's a commonly noticed diagnosis or something that's written on a medical record that someone has pulmonary fibrosis. It may be on a radiological report, but it's important to clarify what's your situation, what's your diagnosis, what's the cause of the fibrosis, what sort of follow-up arrangements you need. And then there may be situations in which, for example, you've had follow-up for maybe a few years and the scars on the lungs have not gotten worse. In that situation, again, maybe you don't require any further follow-up and you would only see the doctor if needed, if your respiratory symptoms change. Or there may also be the situation, as I was mentioning before, where no treatment options are actually available. So maybe in that situation, you may be referred by the pulmonologist, by the respiratory physician to other specialists who can handle those problems that you are having and try to offer you the best solutions in your case. Maybe it's not necessarily the respiratory problem that needs to be addressed first. So that will be in the background there. Maybe we don't have good treatments for it, but we're trying to treat everything else that may be wrong. So what do we normally do when we do follow-up for pulmonary fibrosis cases? When we think that there may be some progression in the future. So this is basically where we need the follow-up, where we have a case, a situation, in which we expect that the scarring may get worse. And this may be in cases where an interstitial lung disease is diagnosed. So things like idiopathic pulmonary fibrosis, non-specific interstitial pneumonia, hypersensitivity pneumonitis, sarcoidosis, or others. There could be a lot of conditions under the umbrella of interstitial lung disease. And then what do we normally do? So I will go over a couple of things involving what happens in consultations, what sort of tests may be done routinely, and whether other specialists will be involved. It's not an exhaustive list, but I'm trying to cover what I would personally do in my clinics and what I've seen other colleagues of mine requesting in the form of tests and things like that. So first of all, it's important to have routine follow-up consultations. If we think that there's a risk of the scarring getting worse over time, just because that we may be able to pick up the progression quickly, maybe institute treatments as necessary in a timely manner. So the follow-up is usually done every 3 to 6 to 9 to 12 months, depending on the case. And also depending on the clinic capacity and doctor availability. This may not always be as easy as one may want. Depending on how stretched the health system is, pulmonary fibrosis and interstitial lung diseases is a bit of an area where there's limited funding in the health system because it's an area of medicine that unfortunately costs a lot of money to run quality services, and we don't have the best outcomes. We don't have these great stories that can be published in the media and everyone would fund these services. So we always struggle with that. And I'm trying not to say this to sound as if I'm complaining, but I have struggled with this in my current role, and other colleagues I know have the same issues. It's an area that has little awareness and little time allocated to it compared to other very severe conditions, such as cancer, for example. So this is just a bit of I was going in a different direction here, but let me go back to where I was. So in a routine follow-up consultation for interstitial lung diseases, we need to have a very detailed discussion with the patient, with you, if you are suffering with such a condition. And we would cover, for example, symptoms. We would ask you about whether you are more breathless than you were maybe 12 months ago, whether you're coughing more, because these are important things that we consider. So for example, if you are more breathless compared to 12 months ago, we may think that then the fibrosis is indeed getting a little bit worse. We may ask you about chest infections, because if you are having a lot of chest infections, a lot of episodes of pneumonia, you need to get a lot of antibiotics from your family doctor, your GP, or some other specialists. There may be some other problem going on that we may want to look into. Whether you've had any hospitalizations. So this could be because you've had flare-ups or exacerbations of the pulmonary fibrosis, which can be really, really difficult to treat, and they can lead to a very rapid and massive decline in lung function and ability to exercise and do these things. If you've been hospitalized, for example, with heart disease, with heart attacks, if you've had surgery, these things can impact sometimes on what types of treatments we may give you. It may mean that you may need to go on a lot of other medications. You may need to be referred to other specialists to try to manage and control these other conditions that are associated with the pulmonary fibrosis, so the comorbidities. We need to treat the comorbidities all the time. We may also ask you about other issues. So again, checking for other conditions. It's really important to remember that pulmonary fibrosis or lung scarring doesn't usually occur on its own. People who have these sort of conditions may have other things going on with them. So your pulmonologist, your respiratory physician may order some other tests sometimes, or refer you maybe for further advice to your family doctor, your GP, if you're having some symptoms that are not consistent with the pulmonary fibrosis, but may require further investigation. So for example, if your pulmonologist suspects that you may have, for instance, issues related to your heart with your thyroid gland, or some other issue that needs some investigation and treatment from another specialist. It's really important to treat what is treatable. So pulmonary fibrosis or lung scarring, at this stage, we don't have medications that would reverse the scarring on the lungs. But that doesn't mean that other conditions that coexist with pulmonary fibrosis cannot be treated. So for example, if your blood pressure or your diabetes are really poorly controlled, this is a very easy win to have appropriate treatments for these things and making sure that you're in the best health possible with regards to other conditions you may be suffering with. We may ask you also about weight loss or weight gain, because these can impact on your breathing and your ability to deal with the pulmonary fibrosis. It's important to note that a lot of patients who struggle with lung scarring and pulmonary fibrosis do tend to lose weight. And this can be because of some underlying medical problem, but also for the simple fact that breathing with stiffened lungs requires more energy. So this is something that you need to compensate for by eating a little bit more, eating more calories than someone who doesn't have to breathe heavily every time they're trying to go for a walk. So weight loss can also be related to other treatments that you're on. So potentially complications such as, appetite loss due to some therapies that you're on. So your doctor may look into this to explore a little bit whether you need some investigations to determine whether there's anything else that we need to look at. So tolerance of treatments prescribed for interstitial lung disease is also an important point to discuss in follow-up consultations. So for example, if you are on antifibrotic or anti-scarring medication, you may sometimes struggle with digestive issues. So for example, medications such as nintedanib may lead to diarrhea. And if you're on this medication, your doctor may ask you about that. They may suggest taking some anti-diarrhea medication to try to manage that. They may try to work with your doses to try to reduce the dose a little bit, maybe if you're really struggling to be on the medication because of the side effects. Low appetite can occur with some of the medications available out there for pulmonary fibrosis. So again, if that links to the weight loss, it's something that your doctor may explore. And then with regards to the anti-scarring medications, you would require regular blood monitoring. So your doctor may inquire whether you are getting these maybe every 3 months or according to your schedule that's been prescribed to you. If you're on immunosuppressant or strong anti-inflammatory medication that reduces your immune response to control the inflammation in the lungs and control the interstitial lung disease. If you're on such medication, your doctor may ask you about repeated chest infections because maybe this is a problem. And if you are getting too many chest infections, it may alter the benefit risk of the medication. So you may require blood monitoring for some of these things as well. So for example, if you're on medication such as methotrexate or mycophenolate, again, your doctor may want to make sure that you are getting the appropriate blood test monitoring for these medications so that we are not causing more harm than good. Another topic that's really important to discuss in consultation is oxygen needs, whether you require extra oxygen, because as the lung fibrosis progresses, some patients may require going on extra oxygen, which is a form of treatment actually. We're correcting the low levels of oxygen in the blood. So your doctor may, for example, do a pulse oximetry in the clinic. They may put a little finger probe just to see what your oxygen level is at rest. They may ask you to walk around a bit and see if the oxygen levels drop, just to see whether there's been any change in that compared to previous consultations. And they may sometimes record those values over time just to see if everything's going okay. They may also send you for an oxygen assessment. This is a more formal check. Whether, for example, when you're walking around, blood levels of oxygen are dropping. And this would be an ambulatory oxygen assessment. So just walking around, checking what the oxygen levels drop, because this is usually when it first starts to be noticeable, when you're doing something really strenuous. And then using oxygen in those situations then could correct the problem and actually help you prevent some complications. Some patients may also require long-term oxygen. They may also require a sleep study to see whether oxygen levels drop overnight. So these are things that your doctor may consider by asking you certain questions during the consultation. Another important component of the consultation is rehabilitation, pulmonary rehabilitation, or basically exercises for the lungs to maintain the strength of the respiratory muscles. And your doctor, your pulmonologist, your respiratory physician may ask you about these things, whether you have been referred to a formal exercise program or whether you are doing some exercises on your own. Even things, simple things like walking, going out of your house for shopping, doing your own shopping, swimming, anything that constitutes an exercise that would put a bit of strain on the respiratory muscles just to maintain their strength. And they may recommend that you do exercises on your own. They may recommend that you have a good diet just to make sure that you're maintaining as well as possible in the face of this difficult condition, which is pulmonary fibrosis. Now, what kind of tests may your doctor request? This is, again, quite important. So they may request some blood tests to monitor your progress, lung function, walking tests, or any other things that may look into other issues. So let's talk a little bit about that. So in terms of blood tests, these are sometimes required if you are on medication. So for example, if you're on anti-scarring medication, like I said before, or on immunosuppressant medication that reduces your immune responses, to check your organ function, to make sure that your liver is fine, your kidneys fine, your blood counts are fine, they may do routine blood checks at every consultation. And this could be every 3 months, 6 months, depending on how your doctors will decide. But usually it's every 3 months. Now, you may also get lung function testing. So lung function testing is breathing tests for the lungs. Your doctor may ask you to do that at every consultation, or it may not be on the same day, but it may be done maybe every 6 to 12 months just to check whether the lung capacities, the lung volumes of air are staying the same and whether the transfer of oxygen into your body is normal. So these can be very, very important to assess the stability of pulmonary fibrosis and interstitial lung diseases. They're essential, I think, in my opinion, and they probably need to be done regularly because it's a way to put numbers on your symptoms or whatever is going on. It's an objective way of measuring the lung capacities. And usually, these are essential for prescribing treatments, especially for anti-fibrotic, anti-scarring medication. They generally require, in most countries around the world, that we demonstrate that there is progression on the lung function volumes, and we need to have these measured before we can prescribe the medication. So the tests that we use as part of lung function is usually spirometry. So this is basically an assessment of the volume of air that you can breathe in and out and how quickly you can do that. And then that is done in a forced maneuver. And that's the spirometry. And as part of that lung function test, on top of that, we tend to measure the gas transfer or the DLCO value. So this is something that your doctor may advise what it means in more detail. I probably will discuss this in another video, but it gives us a lot of information about how quickly you take up oxygen from the air. And it's a sensitive measure that may go down. So that value may go down in the gas transfer. The gas transfer value may go down quicker than the lung volumes will shrink. So in pulmonary fibrosis, as the lungs get stiffer, as the tissue becomes hardened, first, it's the oxygen transfer that's affected, and then the volumes of the lungs shrink. So I hope that makes sense a little bit. But sometimes when that gas transfer value is lower than we would expect, because the lungs maybe look relatively normal, but the value is going down, it may point to another problem. So for example, something related to the vasculature, to the circulation of blood through the lungs. So your doctor can infer a lot of things from these lung function tests, and they are really, really important. Now, what happens if the lung function goes down? I think this is important to mention. So first of all, your doctor will try to determine what is going on. Is this related indeed to the fibrosis? We need to interpret everything in the right context. It could have been just a bad measurement. You could have had a bad day. You could have had the lung function measured immediately after you've been recovering from some kind of episode of pneumonia or chest infection. So then obviously the values will be low. And then we need to repeat that test to make sure that we are indeed seeing a trend of a decline of worsening in the breathing test. It may be that there are some other complications. It may be, for example, that you are developing heart failure. You're developing some other issue that is leading to low lung function. So your doctor needs to rule these things out. But if there is no other cause or explanation for the reducing numbers on the lung function test, it may be that the fibrosis is indeed getting worse. And then what your doctor may do is either, again, repeat the test to confirm that. So that's sometimes done. Or they may consider updating the chest imaging. So basically to look at the lungs with a CT scan, again, just to see whether indeed the numbers fit with the explanation that may be worsening fibrosis or worsening scarring. So we visualize the scarring on a chest CT scan, on a high-resolution chest CT scan. And we also assess with the CT scan whether there's another complication that may have come on that could explain the drop in lung function. So the CT scan is not always necessary because we tend to not do it unless it changes our management. So it's really important because I do see patients in clinic who actually ask to have repeated chest CT scans. And I always need to explain sometimes that it's not necessary in all situations, especially if it's a condition like idiopathic pulmonary fibrosis, where we know that we will have progression in lung function, worsening in lung function over time. Potentially that person is already on treatment. Doing another scan and giving another dose of radiation probably doesn't change what we will do. So it's really important in the context whether we need to have a chest CT scan done or not. And your doctor will explain this in your situation. depending on what's going on in your case. Other things that we may do as tests as part of the follow-up for pulmonary fibrosis cases is to do a walking test. To measure how you are walking, how far you are walking, and whether your oxygen levels go down when you are walking in a formal test. And these tests may be called a 6-minute walk test or a shuttle walk test. So these are formal ways to assess and quick ways to assess your exercise capacity. And if we do these every now and then regularly, it may be a way to measure how you are progressing over time. Because at the beginning, for example, when you are measuring lung function and the pulmonary fibrosis is extremely mild, it may be that the lung function doesn't change very much from one test to another, but it may change on the walk test. So the walk test may change faster, if that makes sense. But it's usually a combination of lung function testing and walking testing, just to determine your functional abilities and how you are progressing with this diagnosis. Now, there's other things that we may do. So there's always something that we need to remember, that between the lungs, there's also the heart. And this is a little bit of a joke that we have as pulmonologists, that cardiologists sometimes tend to forget that there are also lungs around the heart. So this is something between us as specialists that we tend to bounce back and forth because we're trying to determine what's going on. And usually breathlessness can be linked to both the heart and the lungs. But if there are some symptoms that will alert your doctor that maybe there is some kind of a cardiac problem going on, they may refer you for some other tests or for a cardiology review. And this is just to make sure that we are treating any associated conditions properly. So your doctor, your pulmonologist, your respiratory physician may actually send you for some tests before referring you to a cardiologist, just to get ahead of the game a little bit and so that the cardiologist can advise you quicker if you've already got some test results ready for their consultation. So for example, one thing that they may send you for is an echocardiogram, and this is an ultrasound scan of your heart. It's a jelly scan of the heart. There's some jelly put on your chest and someone looks on a monitor at the heart and how it beats. This is very useful in the case of pulmonary disease because it can screen for something called pulmonary hypertension. So pulmonary hypertension is increased pressure between the right side of the heart and the lungs in that artery connecting the two. That can impair if the pressure goes up in that specific blood vessel, and we cannot measure that directly as if we are measuring normal blood pressure. It needs to be estimated based on the ultrasound scan. So we are looking with the echocardiogram to see whether there's increased pressure between the right side of the heart and the lungs, because that can lead to significant circulatory impairment, so the way the blood circulates through the lungs and picks up oxygen. So if you are having pulmonary hypertension or high blood pressure in the pulmonary artery between the right side of the heart and the lungs, it may mean that you are very breathless on exertion. It may explain why you need oxygen on exertion because the blood does not pick up oxygen properly. It doesn't circulate well through the lungs. So that's something that may be picked up with the ultrasound scan of the heart. And it actually is important because there may be some therapies for that. And also, it's a frequent complication in certain types of interstitial lung diseases, especially those associated with connective tissue diseases or autoimmune disorders. So situations such as, for example, systemic sclerosis associated interstitial lung disease. Systemic sclerosis being a condition that affects the skin generally, but it can affect the lungs and lead to fibrosis as well. We know that that can be associated with pulmonary hypertension in many cases. Sarcoidosis as well is one of these examples where these vascular problems may progress faster than the actual lung disease. So it's important to keep track of this. Your doctor may also request sometimes an ECG. So this is a heart trace, just to measure the electrical activity of the heart, or an ECG monitor or a 24-hour monitor to measure how your heart rhythm is behaving over time. Especially if you are getting new palpitations, feeling like your heart's doing anything funny, just to check for any problems that may have occurred with your heart. If you've developed some heart rhythm disturbances, if you have atrial fibrillation, for example, which is a condition affecting the heart rhythm, which can lead to more breathlessness in someone who develops atrial fibrillation because the pump function of the heart is a little bit reduced in that situation. Or there may be a need to check the ECG trace if your doctor is potentially looking at the side effects of some medications, which can be linked to some increases in some intervals on the heart trace. So this is something that's a little bit more nuanced and detailed. I would say that if you need that, your doctor will probably tell you about that. And then your doctor may also request some other specialized tests, depending on your interstitial lung disease, on your own situation. I don't know. It may be that you're having some digestive issues, and your doctor may want to look into that with certain scans or endoscopies or other things like that. Or, for example, for certain interstitial lung diseases such as sarcoidosis, where the inflammation can affect other organs of the body as well, such as the heart, your doctor may every now and then request something called a PET scan, or a positron emission tomography scan, just to look at whether there is active inflammation in some parts of the body. So this is obviously not an exhaustive list, and I think I will try to end this video because it's coming up to 25 minutes and it's been long. If you're here already, I'm hoping this was helpful for you. But please always check with your doctor, who is the best person to advise you in your case on the right type of follow-up for your pulmonary fibrosis or interstitial lung disease case. Again, I hope this was helpful. I hope it gives you some understanding of how the follow-up process goes. And I hope it's less scary to just have this information when you next speak to your doctor, to have a more informed debate and discussion about what you need to be doing in your case. Hope you are well, all the best, and good health.